Good morning, RESDC members. I'm Janelle Peha, and I am your new board president. Also with us today is Steve Fisher, who's RESDC's executive director. He's going to have some closing remarks for you today. Thank you all for being here this morning. We're happy to see so many people joining us for Medicare 101. We look forward to offering more informative events and sessions like this one, both virtually and in person, throughout the rest of this year. And of course, we'll have some fun social gatherings as well. Our presenter today is My Senior Health Plan. They are experts in everything Medicare. RESDC and My Senior Health Plan have enjoyed a solid relationship over the last several years. You may have noticed them at some of our events. They've also helped hundreds of our members over the years, not only in terms of understanding Medicare, but also maximizing their savings. So now our presenter, now I think I'd like to turn it over to Nicole Medina with My Senior Health Plan. She's going to run things this morning and introduce other members of her team who will be presenting the information today. Again, thank you very much for being here. Nicole?
Thank you, Janelle. Just make sure everyone can hear me okay. And we appreciate that lovely introduction. And congratulations again for becoming the new RESDC president. I had the pleasure of sitting next to Janelle and meeting some of you at the recent luncheon. For the holiday luncheon. My name is Nicole Medina, and I cover all things marketing and sales, business development here at My Senior Health Plan. It is an honor to be here today to kick this off. We know it's a little after 10, so there may be people still trickling in. So go ahead, get adjusted, make yourselves comfortable. We're super happy to have you here in the new year and that you decided to join us and spend your morning with us, quite frankly, because it's such a beautiful day here in San Diego. You could be outdoors, walking, gardening, doing something else. But you decided to spend time with us, and that means something. You're here for a reason, and we're excited to dive in and help really mitigate the complexities of Medicare and all of the things that come along with that. So I'm going to go ahead and move to the next slide. So this is just an example of our recent interactions this year. Like Janelle mentioned, Pete Blassie, who's the CEO of My Senior Health Plan, I'll go ahead and introduce him and our other presenters shortly. He's done a fantastic and fabulous job of really supporting the RESDC members, and it's an honor for me to step in this past year to go ahead and help elevate that and support that as well. So here are some of us, also somebody that's inside with My Senior Health Plan, helping out and just supporting at the, I think it was the health fair. Yeah, the health fair picnic that was in October. So that was really great. I got to meet and we got to speak with a lot of you. We were right up front. It seemed like the 4 hours went by in a flash. It was really 1 hour of time. We're looking forward to supporting more events here in the near future. So thank you for stopping by the booth. And if you need anything, you can always reach out to us and find us on myseniorhealthplan.com. Today, just to give you some housekeeping information, this webinar is being recorded, which is fantastic because RESDC will be able to send it out to each and every one of you. And for those that couldn't attend, sorry we missed you, but thank you for watching the recording. And all attendees are muted. We ask that, keep your distractions aside, really tune in because there is a lot of information. Write down your questions. There will be a live interactive Q&A towards the end. Jackie Nudo, who is one of our presenters, is extremely knowledgeable when it comes to everything RESDC, retirement, and Medicare. She's walked hundreds of individuals through the process. So if any questions do come up, just jot them down, submit them. I don't believe there's a Q&A box, but you can submit them in the chat. as well. And we'll be taking a peek at that. And at the end of this event, we will send you the recording along with the Medicare top 10 FAQs and a PDF as well. We host these separately every single month. So if you have a friend, a family member, a neighbor, someone at your church, or bingo or bunco community, feel free to invite them. You can find all of our information and education on the myseniorhealthplan.com website. We have an education hub center under resources. So we're not only about Medicare 101, right? We're about being a resource for seniors throughout the US, particularly here in the San Diego community. Coming up at the end of the month, we also will have a financial elder abuse workshop. We've partnered with California Coast Credit Union. That's in person. Here in La Jolla, we have a brand new event center. It's called My Senior Resource Center. Please feel free to come down to that. You are invited. It's a free workshop and there will be refreshments. So, like I said, you can reach out to us, reach out to Steve. We'll get you more information. And just know everything here today that's shared is going to be kept private. We're compliant. We are an independent resource. We're not affiliated with the Medicare or the US government. So, like I said, all of your questions will remain confidential. And it's my pleasure to introduce you to your webinar hosts today. We have Pete Blassie, who's our president and CEO, who's at the helm of everything here, and Jackie Nudo, who's one of our senior Medicare insurance agents. She's been at this for a decade. She's a wealth of knowledge. She's fantastic and really puts a lot of care and compassion into every single conversation, along with Pete as well. So I'm going to go ahead and introduce Pete, if you can go ahead and come on and unmute yourself.
Thank you so much, Nicole and Jacqueline. I'm so proud of them to be on this webinar with RESDC, and we've been a long supporter of RESDC and partner, which I'm really, really proud of. I love what they're doing in the community and with their membership. It's really amazing, and I want to say thank you for having us on, and congratulations to Janelle as being the new president, and look forward to working with her closer. We're going to make this Medicare 101 a really fun and an interactive experience for everybody. It's just a little bit about My Senior Health Plan. We've been helping Medicare beneficiaries since 2005 as a trusted and guidance for Medicare decisions. So, we pride ourselves on being unbiased and making sure that, you could get your answers, your questions to your answers, and that we have all the different plans. And, it's difficult. There's a lot of people turn 65, and you might be asking questions that can't be answered, and you go to you don't know what a difference between an agent and a broker is. So we're a brokerage, so we're in your court, so we could answer your questions and really try to determine where's the best place for you to land when it comes to Medicare. So there is our independent, unbiased support. And then we're here to simplify Medicare. It could be overwhelming. It's a big part of your life. It's your health. So, and all of our team members are dedicated to serving. And that's the commonality between RESDC and us. We're here to serve. So it goes beyond just signing somebody up on a plan. Many times you may not need our switching a plan or our help to switch a plan. We just tell you you're good where you're at. But then if you do switch a plan, it's our ongoing support that really, where we really shine. So we've done a lot in San Diego, trying to connect with our community. You might have seen us on Fox 5 and KUSI. Senior Style is a is a show on Fox 5 that you might see me on a number of different times, and perhaps here in January as well. So we've been nominated for the BBB Torch Awards for Ethics, which we're very proud of. It's very close to our heart and our team's heart and our mission. So, and we partner with different communities, Walk to End Alzheimer's here in San Diego, Senior Tech Connect, which they're dedicated for seniors to learn more about technology, which is really important with the ever-changing technology landscape. So we're we connect with them, and we like their mission as well. So, I mean,
I'm Pete Blassie.
Here's a little bit about my senior health plan and a commercial that I'll come back.
I'm Pete Blassie, President and CEO of MySeniorHealthPlan.com. For over 20 years, we've been a trusted source of unbiased advice for the Medicare eligible community. Our experienced, professional, and licensed staff are dedicated to helping you navigate the process of finding the right Medicare insurance plan. Our service is offered at no additional cost, and we are licensed nationwide. Book an appointment with us today by visiting MySeniorHealthPlan.com or call us toll-free at 877-255-6273. We're here to serve you.
Thank you so much, Nicole, for that. So, Jackie's going to dive into Medicare 101. It's a bit of information, but we're going to walk you through it, and she'll talk you through what's the difference between a broker and an agency. But before she does that, I do want to touch on, I'm just so proud to be, working with RESDC for almost a decade now, and in speaking with our RESDC members, really understanding the group county program. I think we really shine there and dive into those benefits, and it does change for every graduation year of retirees. So Jacqueline has spearheaded that program and really dives in and makes sure that if there is a change needed, it's really a big benefit to the RESDC member, and it means a lot to us. So we're proud to say that, I'll say, some people have saved up to $6,000 a year by, evaluating, going on an individual program. But Jacqueline spearheads that. I'm really, really proud of her as she walks people through it and cascades all that information out to our team. So I know, Jacqueline, are you going to take this slide with what's the difference between a broker and an agent? Would you like me to?
So a little bit about the difference between brokers and agents. Brokers, we work with multiple carriers. We're not just going to represent one carrier, whereas an agent might be captive. Another big difference with us is we've got a support team, which is a huge key for our clients in the long run. We've got an entire customer service team here dedicated to helping our clients should you have things like customer service questions in the future. Agents may not always have that team. Now, we are paid by carriers. This is a service that is no cost to you. And compensation is always regulated by CMS. The pay is the same across the board, no matter which carrier we recommend to you. And the reason why that's important is because we are not going to pigeonhole you into a particular plan or a particular company that might be more financially beneficial to us. And one of the biggest things here that we want to ensure our clients is, do you even need our services? We always want to do what's right for you, and we'll be the first to tell you should you not even need our services and you're on the perfect plan for your situation.
So a little bit about Jacqueline. I just want to present her. Jacqueline has been serving the senior community for nearly a decade. She's helped thousands of Medicare eligible recipients nationwide. For those, know a little bit about Medicare, those that are disabled, as well, that receive Medicare. people on very challenging situations, but she really, dives into these situations and really, flushes it out and makes sure that the person is landing on a good solid ground. She brings a global perspective from living overseas, and she's passionate about exploring these cultural cuisines. She's a definitely foodie, and she's been to a lot of different places. So and she's really fun to speak with. So she's recently visited Japan, and that's definitely something you could ask her about. A lot of things happening there. So I'm really proud to have Jacqueline on the team. So this is the agenda a bit. I'm going to just run through it. And again, we try to make it a fun and interactive experience. There's going to be time for questions at the end as well. And we'll try to field as many of those questions as we can. Nicole heads that up, and she does a fantastic job doing that. We're going to talk what is Medicare. It's not it's different than Medicaid, original Medicare. Medicare administration, how is it all divvied out? Medicare eligibility, who's eligible and how much does it cost and what does it cover and what doesn't it cover and how we fill in the gaps of coverage. So, and where are those gaps, right? So we all want to know that, what are our Medicare Advantage plans? You see that all over different commercials, and there's so many different types, and it could be confusing. Prescription drug programs, and when can you enroll into Medicare? And where do I go for help? So for your original Medicare, and where do you go for these different types of gap coverages? So we're going to do a bit of Q&A, and then we'll do a wrap up on that. But I promise you'll get a lot out of it, and Jacqueline does a fantastic job.
So Medicare, I know, can be this giant, huge mountain of information. Where do you even start? Well, you really have to start with original Medicare. So what is Medicare exactly? Well, Medicare is federal health insurance that was initially created for people who are 65 years and older, but it has been expanded since to also include those with disability. So initially, there were 19 million Americans enrolled in Medicare within its first year. Now, well, as of 2023, we've got up to 66 million enrollees. So original Medicare, that consists of Part A and Part B. Fun fact, the first Medicare beneficiaries were actually the First Lady Truman and the President. Back then, it was about $3 per month for Part B's premium. And of course, like most things, it has gone up significantly. This year, it's about $202.90. So again, when you think of Medicare, first think of Medicare as original Medicare, which consists of Part A and Part B, which we'll go into more detail in a bit. So who is eligible for Medicare? Well, remember, Medicare was initially created for people who are 65 years and older. So you do become eligible for Medicare when you turn 65, unless you qualify early because of a certain disability. Some disabilities that would allow you to have Medicare early would be Lou Gehrig's disease and end-stage renal disease. And original Medicare consists of Part A and Part B. Part A is inpatient hospitalization. Part B is outpatient medical services. So here's our first poll question, just to get to learn a little bit more about our audience today. So which of the following describes your current relationship with Medicare? We'll give you a minute here to answer. Okay, so let's take a look at this. Now, the options were I'm turning 65 and enrolling into Medicare for the first time, so it looks like a good portion of you fall in that category. I'm a caregiver currently managing a senior's health benefit, so that's also a very common situation. And it looks like the most common situation today is I'm currently enrolled in Medicare. So for that group, maybe you need a little bit more information on how your current coverage works, or you just want assurance that your current policy is the most suitable for your situation. And it doesn't look like we've got anybody here who qualified early due to a disability. Okay, so again, original Medicare is Part A and Part B. So let's talk a little bit more about that and also how it's administered. So remember, Part A is inpatient hospitalization if you have to stay overnight in a hospital. Part B is for outpatient and medical services, like my primary care physician visits or my specialist visits would all fall under Part B. Now, Part A, again, inpatient hospitalization, that does include things like semi-private rooms, hospital meals, drugs and medical supplies that you might need while you're in the hospital. It also includes things like lab tests, x-rays, radiation, and rehabilitation services like physical therapy, as well as hospice and skilled nursing. So all of that falls under Part A, again, part of original Medicare. Now, Part B, this includes doctor visits, also emergency room visits, urgent care visits, tests and diagnostic procedures, physical exams, preventative care like flu vaccines, durable medical equipment, canes, walkers, CPAP machines. All of these things fall under original Medicare Part B, which is medical services. Now, original Medicare is administered by the federal government. So Part A and Part B is administered through the federal government. You can register for it through Social Security. Secondary insurance, which we'll go into more detail about, that's administered through private insurance companies and brokers like My Senior Health Plan. That consists of C, D, and Medicare supplement plans. So here's another poll question to get a little bit to learn a little bit more about you today. What is the main question you hope to have answered regarding your Medicare coverage? Okay, so the options were, can I drop my employer health insurance for Medicare? It looks like very few of you land in that category. When should I enroll into Medicare? Very common question. It looks like a big chunk of the group today has questions about that, which we'll go into. Am I on the right plan? Absolutely important. Everyone wants to know what the changes are from year to year. What exactly does Medicare cover? How do I switch plans, and what are my out-of-pocket costs? So we're actually going to cover a good portion of these questions today. So let's try to learn a little bit more about the costs of Medicare. Now, original Medicare Part A and Part B, again, is the federal government health insurance. And Part A actually has a $0 monthly premium as long as you've worked at least 10 years total. You probably noticed Medicare taxes being deducted from your income. All of that went towards Part A. After 10 years of work history, you were paid into and qualified for Part A at $0. Now, there is still out-of-pocket costs, even though there is no monthly premium. For example, for each benefit period, there's a $1,716 deductible. And that's not annually, that's per hospitalization benefit period. So you could potentially have to meet that deductible multiple times in a single year. Now, for Part B, it doesn't matter how many years you've worked. Part B does have a monthly premium. This year it is $202.90. But even after you've paid that monthly premium, there is still an annual deductible of $283, and that does increase from year to year, and then an unlimited 20% coinsurance. So unfortunately, what that means is no matter how expensive your medical bills are, you are going to owe 20% coinsurance towards that medical bill. So that's the cost for Part A and Part B. Now, there are certain things that Part A and Part B don't cover. For example, hearing tests, routine eye care with your optometrist, routine dental work, routine foot care. That could include getting your toenails trimmed, removal of corns or calluses, also foreign travel. None of this is unfortunately covered by original Medicare Part A and Part B. So here's another question to learn a little bit more about you. What are your thoughts on your current coverage? Since many of you are already on Medicare, you may not know the ins and outs of your coverage entirely. So we'll give you a minute to answer. Okay, so let's go over the options here. Regarding your current coverage, it looks like a good portion of you couldn't be happier with your coverage. That's very good news. Some of you are unsure because you rarely utilize your plan or you simply don't understand it. And a few of you are dissatisfied with your coverage. Some of you feel that it is too expensive. And some of you are just looking for more extra benefits. And a good portion, of course, need help understanding benefits. And yes, it can be very confusing, and it looks like a good portion are not currently Medicare beneficiaries yet. So as we just learned, original Medicare Part A and Part B is not 100% coverage. So how do you bridge the gap in coverage? How do you fill those holes? Well, you do it with Medicare secondary insurance. So we'll start off with what's called a Medicare supplement plan. You might also have heard the term Medigap policies. These are not federal government insurance. They are administered through private insurance companies. Now, we're very used to thinking in terms of HMO and PPO for health insurance because that's what employer coverage comes in, and that's what Affordable Care Act plans come in. But supplement plans are neither HMO nor PPO type of policies. They simply have no network. What that means is if you have a supplement plan, you can actually see any doctor you like who accepts original Medicare. And the purpose of a supplement plan is to fill in the gaps that Part A and Part B have, like Part A's benefit period deductibles and Part B's deductible, as well as the 20% coinsurance. Now, unlike other types of health insurance, Medicare supplement plans can actually decline you based on your pre-existing conditions. But when you first turn 65, you can skip medical underwriting, your what's called guaranteed issue. Now, these types of policies don't actually cover prescriptions because neither Part A or Part B cover prescriptions. So whenever you have a Medicare supplement plan, we also pair it with what's called a basic prescription drug plan. And these are also known as Part D of Medicare. These are also administered through private insurance companies like a supplement plan. They do nothing for hospital and medical copays and deductibles. Their main purpose is to fill in your lack of prescription coverage. That's why we'll typically pair a drug plan with a Medicare supplement plan. Now, each drug plan is a little unique when it comes to formulary, so we do take a look at your current prescriptions to help narrow down a policy. So that's option one, a supplement plan and a drug plan combination. The second option is through what's called a Medicare Advantage plan. These are also known as Part C of Medicare, and these are HMOs or PPOs, so they're structured a bit more similarly to employer coverage or Affordable Care Act plans. These will actually combine your Part A, Part B, and drug policy all rolled into one convenient to use plan. So again, it works very much like an employer policy that you might have had in the past. Now, these also tend to include extra benefits that aren't usually covered by original Medicare, like routine visits to your optometrist, routine visits to your dentist, also hearing benefits or fitness memberships. Now, again, this is also another method to help you fill in the gaps that Part A and Part B have. And these Advantage plans include several extra benefits that you wouldn't typically get from Medicare. So foreign travel is another common one, chiropractic care, over-the-counter benefits or an allowance to put towards things like pain and cold medicines. There's also sometimes transportation included. So it's very comprehensive. Now, like drug plans to supplement plans, you can also have an indemnity plan paired with your Part C or Advantage plan. And the reason why hospital indemnity plans are often paired with Advantage plans is because HMOs and PPOs typically have copays and coinsurances as you use services, especially for hospitalization. Oftentimes, when we're hospitalized, we don't know how long we're going to be in the hospital, and many plans charge per night. So these hospital indemnity policies kick in when you are hospitalized and give you a benefit to put towards your copays and coinsurances and other services. So hospital indemnity plans can also be paired with other policies like employer coverage, not just strictly Medicare Advantage plans. So these, again, are types of policies that we would pair with a Medicare Advantage plan because Advantage plans are the ones that have copays and coinsurances for inpatient hospitalization, and these indemnity policies can help fill in those gaps. So Medicare options do vary by not just state, but also county. Now, we're licensed in all 50 states. So again, things like Medicare Advantage plans and drug plans, they can vary from not just county or state to state, but also county to county. San Diego's options are not going to be the same as our neighbors, Orange County or Los Angeles County. So another big question many of you had is, when should you actually start enrolling into Medicare? So when it comes to enrolling into Medicare, you really have to think in terms of when to enroll into Part A and Part B, and when to enroll into your secondary insurance. So the time frame to register for original Medicare, Part A and Part B, is usually around your 65th birthday. This is what's called the initial enrollment period. You have a window of 7 months, and it starts 3 months before your birthday month. You've got the month of your birthday, and then another 3 months after to finish your enrollment into Part A and Part B. If you happen to miss that window, every year between January and the end of March, we have what's called the general enrollment period. So this is the time frame for you to register for Part A and Part B in the off chance that you missed your initial enrollment period. Or you can use what's called a special enrollment period. Think of this as a life-changing event. For example, retirement and losing your employer coverage. If you did not need to register for Medicare when you first turned 65, you can also use one of these future life-changing events. a special enrollment period to enroll into Part A and Part B. Now, the second set of rules or windows to enroll into Medicare pertain to secondary insurance. This includes supplement plans, drug plans, and advantage plans. So you can also use your 65th birthday, the 3 months before your birthday, month of, and 3 months after. That's called your initial enrollment period. And then every single year, we've got what's called the annual enrollment period. That runs from October 15th through December 7th. And this is your opportunity to enroll into a policy if you happen to have missed your initial enrollment period, or to reevaluate your plan for the coming year. Between January through the end of March, which is what we're in now, you've got what's called the open enrollment period, which is very similar, but it's specifically for those with Medicare Advantage plans to change policies or reevaluate your plan. And then, of course, there are several life-changing events that you might qualify for throughout the year. For example, retirement and losing employer coverage. And then you've got what's called the guaranteed issue for Medigap policies. When you first turn 65 or when you first enroll into Medicare Part B, you're exempt from having to answer questions about your health to qualify for a Medigap supplement plan. That's also known as medical underwriting. So these are the windows for you to register into secondary insurance. And there's quite a bit. You don't have to memorize all of them. The main ones to memorize would be your 65th birthday, and of course the annual enrollment period, which runs from October 15th through December 7th, and open enrollment period, which we're in now. So here's some common life-changing events that we run into on a regular basis. Loss of existing coverage. That could be your employer plan or even retirement employer coverage. Sometimes you have just a chance to get other coverage. Oftentimes that's because of a move. If you move from one county to another or one state to another, that is considered one of these life-changing events. Very common for people to relocate after retirement. And there's also situations where someone might have both Medicare and Medi-Cal. These individuals are called Medi-Medis or dual individuals. And this is actually also a life-changing event that allows you to change your policy. And some individuals might have chronic conditions like diabetes, for example, cardiovascular disease. This type of pre-existing condition can actually qualify you for one of these life-changing events to enroll into a Medicare Advantage plan. Now, the major time or the main time to really consider enrolling into Medicare is, of course, your 65th birthday, which is going to give you a 7-month window, 3 months before your birthday month, the month of, and then another 3 months after. So there are a few steps to enrolling into Medicare Part A and Part B through Social Security. The main one is determining if you even need Part A and Part B, or if you need maybe just one or the other. Some people could actually be automatically enrolled into Medicare Part A and Part B and won't actually have to submit an application. So we can help you determine if you fall into that category. And of course, whether or not you even need Part A and Part B at the time of your 65th birthday. Now, if you do need both Part A and Part B, you can enroll online, in person at a local Social Security office, or over the phone. From there, it usually takes maybe Social Security about 45 days or so to process your application and send out your Medicare ID card. Now, you don't necessarily have to wait for your physical card to deliver to start looking into your Medicare secondary insurance options, because as you can see, it does take Social Security a bit of time, and we always recommend starting early, looking into your secondary insurance, just so you don't miss any deadlines. Now, again, you don't necessarily need your physical ID to start looking into Medicare secondary insurance, just so that you can absorb the information and make your decisions. And once you do have your secondary insurance decided on, we're here to help you facilitate that enrollment. And even after you've enrolled into your policy, we've got, again, a whole customer service team here dedicated to helping our clients, because this is usually not a one and done thing. You might run into customer service questions in the future, or you might need a policy review because your overall health needs have changed. So when you first give us a call, here's a little bit more about what to expect. Again, we do an initial assessment because not everybody necessarily needs our services. So we'll look into your current coverage, help you understand it a little bit more, and then go from there. Now, remember, prescription plans and Medicare Advantage plans, they can vary when it comes to prescription costs and doctor coverage. We want to be sure that we help you find a policy that not only covers your prescriptions, but also charges the least amount for them, as well as help you maintain access to your preferred providers. We work with most major carriers and will help you narrow down policies that work for your needs and priorities. Again, does it cover your doctors? Does it cover your prescriptions? And does it provide the types of services that you're looking for? So we definitely want to take a look at your current needs and also potential future needs when narrowing down policies. We also take a look at things like, are you planning on moving in the future? Do you have any particular concerns when it comes to healthcare? We use all of these bits of information to help you really understand your options and what your future options might be. And of course, once you have narrowed down a policy and enrolled, it is usually not a one and done thing. So we've got an entire post-enrollment support team to help you. Again, common issues would be, you know what, I got a bill. I don't understand what this bill is for. You can call us. You don't have to navigate all this by yourself. Or my health needs have changed. I really need to reevaluate what my options are for healthcare. You can give us a call for that in the future as well. So Medicare can definitely be confusing, very understandable. Here's some common things we hear every day. Do I need the entire alphabet? Do I need C, D, G, F? Do I even need a Medicare Advantage plan or a supplement plan? Or why can't Social Security give me everything I need? Why can't I just go there and have everything settled? Am I going to be forced to change my doctors? What do Medicare supplement plans do exactly? And what if I can't afford coverage? Does Medicare cover me while I'm traveling outside of the US? So these are all very, very common questions that we run into on a daily basis. So why work with my senior health plan? Well, we, again, give personalized professional guidance. First thing I want to take a look at when I work with clients is, do you even need my services? And we're committed from there to provide you tailored guidance and support, not just when you're initially enrolling, but also down the road. And we give you unbiased, transparent advice. We work with most carriers. And if none of the policies that we offer are the most suitable for your situation, we'll be the first to tell you that. Medicare also changes from year to year, not just costs, but also options. We stay informed and let you know what to expect for the coming years. And of course, our services are always at no cost, completely free. And from education of your options to enrollment and lifetime support, you don't pay a dime for our expert assistance. And again, we do work with most carriers. So we have gotten quite a few reviews in the past. We used to get letters. Now we usually get Google reviews or online reviews, and I'll have Pete step in to go over this.
Yeah, for many, many years, people would write in and just say, thank you for our service. And we would share these letters among our staff. And we're just so proud of them. Now in this whole Google age, you can write a Google review. And we're proud of our reviews, many 5-star reviews, how we assisted them. And we've taken the time and to sort it out. So we're very part of these reviews. I invite you to go onto Google and read them for yourself. But yeah, and Jacqueline has a tremendous amount of these reviews, of course, as well. So you know, if you go online, you could definitely read them for yourself. So a little bit about our Medicare journey here, and when it's time to reach out to us. So there's your initial enrollment period, and this is the time you become Medicare eligible. So that's definitely a time when 3 months before you turn 65, there's a month of, and 3 months after is your initial enrollment period. There's different life changes if you're moving from state to state. So every time you move out of the county, actually, you need to reevaluate your Medicare plan, because these plans, especially the prescription drugs, Medicare Advantage programs, are very specific to the county. So when you move into a new county, and remember, we're licensed nationwide, we could assist you anywhere. You need to reevaluate that plan. And sometimes you just go onto the same plan that you were in that county if it's offered, but you really should evaluate the plan when you go into that new county, because there's different offerings in different counties. Moreover, if you don't make a switch within 2 months, they'll cancel the plan because they really want you enrolled into that county plan. So those are some of the life changes coming off a group. You could come off a group during really any time of the year. I think that's most applicable to this group that we have online today. So some people think, well, you have to wait until the annual enrollment period. You really don't. You could come off at any time and evaluate that your program. So the third kind of step is after you're enrolled into any type of program, you really want to review it annually. These programs, whether it be a group program, individual Medicare program, they really have to be reviewed annually, because these benefits change annually, and you change every year as well. So your needs change, these plans change, so you definitely want to review them annually. So the fourth piece is that you want to call us for questions about your plan that we've enrolled you in to, or the plan that you're on. So we're always here to assist, and then our service comes at no charge. So we're very proud of that. So if you like to schedule an individual appointment, of course, you could scan this QR code or give us a call at the phone number 866-210-1544. And you can schedule your time with Jacqueline or one of our other Medicare experts. So this is your time to do that. We also have different language support in Spanish, Chinese, Korean. So we do support these languages as well. You could go and learn more about us on myseniorhealthplan.com to get some additional information, frequently asked questions, and download our Medicare 101 booklet as well. So I believe Nicole's going to take this slide and talk a little bit about some questions that you might have, and she'll field those questions now.
Yes, hi everyone. It's so great to be back. Now is your opportunity to jump in and start asking your questions. There's not a Q&A box here, but you can start putting your questions here in the chat, or I believe there's an opportunity to raise your hand, but we'll give you a few minutes to collect your thoughts, like 1 to 2. And in that time frame, I'd love Pete to jump back on to just give you a little bit of indication of the San Diego market and how we are experts with that. I'd love for him to just jump on and talk about the health systems, what's happening. There's been some disruption. So Pete, while everyone's collecting their thoughts for questions, we'll go ahead and just have you jump on for like a minute to go ahead and talk about that, please.
Yes. When it comes to San Diego market, we really understand it. Our office is here in La Jolla, and we work with a lot of these medical groups very closely, like UCSD and Sharp and Scripps and many other affiliated groups like Perlman Clinic, Regal Medical Group, just to name a few. So there has been some changes within the Medicare landscape when it comes to these affiliated groups, like UCSD, no longer accepting Humana directly, but you may be able to get them indirectly. There's been some challenges in some care coordination as far as their primary care coordination from some of these medical groups, that they're not accepting some plans, but it's okay. We are here to sort it out. So we have the answers to all these questions. Jacqueline knows this inside and out, and our team are constantly updated with the Medicare landscape when it comes to all these different medical groups. Whether you're going to Sharp or Scripps or UCSD or a lot of these other medical groups, even in North County, like greater Tri-Cities area. So, we're here to answer your questions, and I think that's what makes us very special to work with here in San Diego. We really understand this landscape.
Thank you, Pete. I'm jumping back on because I believe that the chat is not enabled on the back end. So RESDC, if we can get your tech support to get that going, that would be great. We want to answer your questions. I did notice throughout the webinar, there wasn't much coming in.
I just received one, so it is working.
Okay.
The question is, do you work with Kaiser?
Got it. Great question. I'll go ahead and have Jackie jump on in. And in the meantime, I'm going to go ahead and put the slide back up that gives our phone number, the QR code, how you can make an appointment with us, just in case your question is not answered.
Yeah, that's the only plan currently we don't work with. Kaiser generally doesn't broker their plan, but we do have a contact that we could pass off to at Kaiser. But we have been in talks with them. They generally do not broker their plan here in San Diego.
Yes, and even though we don't offer Kaiser, we do let you know what they offer in the county that you currently live in. For example, in San Diego, there's only really 2 Medicare Advantage plans, or if you're moving to a different county like San Francisco, we don't offer them, but we'll let you know what to expect and give you the contact to enroll.
Just a reminder, we had a friendly reminder from a participant that chat is working. Make sure you remember to pick a recipient. Ideally, it would either be My Senior Health Plan or Jacqueline Nudo. Just keep that in mind if you do have those questions.
Thank you. In the meantime, Jackie, I'd love for you to talk about your experience the other day speaking with RESDC, Santa Barbara County, one of those individuals from there who called in and was very confused, had some questions. I think this would really be a great time to explain our service and how we are here to really help in the process.
Yes. So one of the common questions we get on a regular basis is, what am I actually paying for? What are all these premiums that are being sent? And I know a lot of you had mentioned that you don't fully understand your health coverage. Now, remember, with Medicare, there are different premiums. You're paying a premium to the federal government, and you're also paying a premium to your secondary insurance. That it can include supplement plans, advantage plans, but it can also include retiree policies. Now, there are a couple of things that might affect your overall premium for Medicare coverage. That includes what's called a late enrollment penalty and also what's called income-related monthly adjustment amount. So if you did not enroll into Medicare when you were initially supposed to, you can actually incur a penalty, which is called the late enrollment penalty, and that affects 2 parts of Medicare. That affects Part B, as in boy, that's your medical services, and also drug coverage, Part D. And since many Medicare Advantage plans cover prescriptions, this late enrollment penalty can be tacked on to not just your drug policy, but also your Advantage policy that has drug coverage. Now, for income-related monthly adjustment amount, this is for high-income earners. You might actually pay a higher amount for your Part B and drug coverage on a sliding scale based on your adjusted gross income. So these are things that we look into with our clients when they call in to help determine if the premium they're paying for is in fact being affected by late enrollment penalty or income-related monthly adjustment amount. It happens quite often, and it can also affect retiree health policies that are structured like Advantage plans and drug plans.
Thank you. I do see some questions coming in here. I'm going to go through them. How does Medicare work with VA medical?
So that's a good question. My father uses the VA. Medicare is not billed at all by the VA. So if you use the VA, your VA providers do not bill Part A or Part B or secondary insurance. Now, the good news is your Medicare coverage and Medicare secondary insurance options will not affect your access to the VA. So oftentimes we'll have clients who say, you know what, I like my VA doctors, but just in case I'm traveling or just in case an emergency happens, I'd like some type of secondary insurance. And regardless of what they choose, again, it does not affect their VA doctors or access to VA providers at all. You can, in fact, have both VA and Medicare as well as secondary insurance. But if you're strictly using your VA doctors, do you need Medicare? Not necessarily. There are a few things to consider, however, before you decline Medicare altogether, which includes the late enrollment penalty. So oftentimes in these cases, we'll talk a little bit more in depth about your priorities, your health needs, and how much you actually use VA providers versus doctors outside of the VA.
Thank you. Our next question, it's a little bit related to Kaiser, but there's two parts. I'm currently with Kaiser on my employer plan. I want to apply for Medicare in February. My date of birth is 5/5. Is the process any different if I'm staying with Kaiser for Medicare Advantage? Second part is, can you discuss moving abroad?
So that's a very good question. So let's start with moving abroad. Original Medicare Part A and Part B, again, does not work when you are outside of the country, not just for vacations, but also for permanent residence. Now, you can decline Medicare while you're overseas, but there are some drawbacks to that, like, again, the late enrollment penalty. So we definitely need to discuss how often you plan on coming back to the US, is the move permanent, and those sorts of things. But again, some policies like Advantage plans might have limited coverage for emergency and urgent situations while you're living abroad or while you're traveling. However, Advantage plans do require you to maintain original Medicare Part A and Part B in order to stay enrolled. Now, the process for enrolling into Kaiser's Medicare Advantage plan is no different than any other company. So you are going to need to enroll into Part A and Part B, and then into Medicare or Kaiser's Medicare Advantage plan once you've obtained your Medicare number.
Great. And the next question is, can you obtain a hospital indemnity plan with Kaiser Advantage?
Yes. So hospital indemnity policies are not necessarily attached to a specific Advantage plan. They're a separate policy altogether. And you do need to have an actual hospitalization event for that indemnity policy to kick in.
Great. And if I'm interested in the hospital indemnity plan, what does the pricing look like?
So it really depends on the benefits that you're looking into. Are you adding on any riders, your age, and where you live? So we'll go over that when we go over your secondary insurance as well.
Thank you. The next question is about explaining how one ClassPass works with gym memberships, if you're familiar with that.
Yes. So policies often utilize third parties to administer these fitness benefits. OnePass is one of them, Silver Sneakers is another, Silver and Fit, and Renew Active. So they all work very similarly. However, the network of gyms that participate might vary from one service to another. So OnePass, again, just has a list of participating gyms, and generally you register your policy with OnePass to gain access to these participating gyms.
Okay, and the next question is, I was in law enforcement and did not participate in Social Security. Do I still qualify for Medicare?
Yes, you still qualify, but your monthly premiums for Part A might be affected.
Great. And then can you switch from an Advantage plan to a regular plan plus a supplement plan and vice versa?
Absolutely. So we talk about this quite a bit because I like to remind my clients, whatever you choose first, you're not locked into permanently, but you have to understand your windows of opportunity to enroll. With a Medicare Advantage plan, the thing to remember is your pre-existing conditions are not a factor. These types of policies don't have you go through medical underwriting. In order to enroll or disenroll from an Advantage plan, you have to have an event, a life-changing event, or what's called an election period, which will help you shake out. So that's to get in and out of an Advantage plan. For supplement plans, you can actually change your supplement plan, enroll into your supplement plan, or drop your supplement plan anytime you want to throughout the year. It's not a matter of do you have a valid election period. For supplement plans, what you have to remember is, do you have to go through medical underwriting or are you exempt? Are you what's called guaranteed issue? So when moving between Advantage plans and supplement plans, we have to have a valid election period to get you out of your Advantage plan and a valid guaranteed issue situation to get you into a supplement plan. And I know that sounds very complicated. You don't have to memorize these things on your own. Let me know what you're trying to accomplish, and I'll let you know when the windows of opportunity are to do that type of move.
Can you explain supplemental hospital insurance for a supplemental plan G, costs, etc.?
Yes. So Medicare supplement plans are the ones that allow you to see any doctor you like, and they help you fill in the gaps that Part A and Part B have. The top three policies are F, G, and N. So Plan G, I'd consider maybe the second in line. It actually will cover your inpatient hospitalization deductible and copays entirely. So if you're ever hospitalized and you've got Plan G, you don't have a deductible to meet and you don't have any copays should you be hospitalized for more than maybe 60 consecutive days. But there are limitations on how long you can stay in a hospital.
Thank you. We know we're at the top of the hour. We just have a couple more questions. Let's get those filled in and answered since most of you are still here. So we want to thank you for jumping in, paying attention, having questions. Next question is, do you have to be in San Diego County, a retiree to use this service? Can it be anyone or someone that lives in another state?
Great question. I'm here in our San Diego office, but I'm actually licensed in all 50 states. So yes, no matter where you live, you can utilize our services. And no, you don't have to be a retiree from the county or a RESDC member. We're here to help anybody who has questions about Medicare. And I do have a question in the chat here. I've seen tons of YouTube ads that advocate against Medicare Senior Advantage plans. Is it really not a good choice? I've had a Senior Advantage plan for many years. And could you explain the different tiers for drug meds and the importance of checking to avoid which drugs one takes are covered in these tiers and the sticker shock? So I wouldn't think in terms of bad coverage, good coverage. Think in terms of what are my priorities and does this health insurance policy fit my needs? Not everyone has the same needs. So it is too much of a blanket statement to say Medicare Advantage plans are terrible because Medicare Advantage plans are structured as HMOs. You might be already very familiar with how Advantage plans work. Your employer coverage was an HMO or PPO. Affordable Care Act plans are HMOs and PPOs. And that's exactly how Medicare Advantage plans are structured. They're either going to be HMOs or PPOs. And just remember that HMOs are going to have a few restrictions like requiring referrals to see a specialist. Is that necessarily bad? Not at all, especially if you've been used to HMO systems and the overall benefits and maybe costs that that HMO has fits your budget, your needs, and your priorities. Now, when it comes to drug coverage, typically there are maybe 5 to 6 tiers, tier 1 and tier 2 being the least expensive, generic prescriptions like levothyroxine, for example. So each policy, they're not obligated to cover every single drug that Medicare covers, but they are obligated to cover at least 2 drugs from each drug category. And they can pick which tier that specific drug falls under. That's why your specific list of prescriptions can vary quite a bit from one policy to another. Now, whenever we enroll you in a policy, we factor in all of the prescriptions you take, and we let you know what your costs are going to be depending on which policy you choose. But I also recommend my clients review their plan every single year during the annual enrollment period so that you can understand what to expect for the coming year. Now, if you happen to be prescribed a drug out of the blue or in the middle of the year, there are several options for you to help mitigate those costs if they happen to not be on the formulary. And that's what our post-enrollment support is really here for those types of situations. Call us, let us know what happened, what changed, and we'll let you know what your options are to help you, again, mitigate those extremely high prescription costs.
It looks like we've answered all of the questions, and we're just a few minutes over, but we really do appreciate your time. You've had excellent questions. If there's anything else that you'd like to ask, now is your time, and or to schedule that appointment, you can click, actually you can take a picture of the QR code. I'm going to drop the appointment link here in the chat one more time. So give me one moment so you can click through that. Also, you will be sent an email follow-up with all of this information. So don't worry if you didn't jot it down. There's a lot to absorb, a lot to take in, take a breather, process everything. But when in doubt, just know that we're in your corner. We're here to help you figure it all out. Jackie, Pete, the entire team, we are experts. We've been doing this for so long. So we are very honored to have been able to be here today. And I'm going to bring Pete back up to go ahead and thank everyone and close this out.
I want to thank all of RESDC, including Janelle and Steve and Karen and everybody that's on this call today. Also, my incredible team, Jacqueline and Nicole, want to say thank you for putting this all together. You did an excellent job. Really proud of our RESDC relationship that we've had for many years and many years to come, and we're here to support RESDC in all their endeavors. I think they're doing an amazing job with their membership, and it couldn't be prouder to be a part. So I want to say thank you. So I believe this. Without further ado, I think our webinar has ended. So enjoy this beautiful day in San Diego.
Yeah, and I think Steve was just going to pop up as well.
Good.
Hello, RESDC members. Thank you so much for being here. Giant thanks to Pete and Jackie and Nicole from My Senior Health Plan. Thank you so much. That will, in fact, just about do it. One thing to remember, this will be posted to the RESDC website. So if you missed it, and you will get an email too, so there's no shortage of information again. We have a wonderful, interesting webinar coming up next March from the FBI field office here in San Diego. Really interesting stuff. Do not miss that. And all that being said, again, thank you so much, and everyone have a wonderful day.
Thank you. Thank you.